What's going on, everyone? Happy Friday. Hopefully everyone is doing well, staying safe, healthy, testing negative for the viruses, and having a great day so far. It is time now for the Friday edition of the Virus Update for Friday, September 5th, 2025. If you're new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. There's a lot of viruses out there, but not enough attention is given to them. Not enough media coverage, so that's where I come into play. I show you the latest data, news, wastewater, and anything I can find to keep you informed and safe from what is going on with these viruses. Give me the next 15 to 20 minutes, and you'll be updated as to what's going on as of today. If you like today's video, give it a thumbs up. If you're new here, consider subscribing down below. Hit that notification bell. Share this video with anyone you know. Leave your comments down below. And if you'd like to support the channel, there are ways to do that down below. The CDC is reporting that regions 1 and 7 are having the highest positivity rates since September of 2024. That's right, the spikes in those areas are pretty significant. Region 1, which does include Boston, sees the most since the biggest spikes since July 6th of 2024. This is as of August 30th, and testing is highest since April 26th. And you can see there's Region 1, which includes Boston. Region 7 is a central region, which includes Kansas City. Already, we do have several more updates to come. In California, Sacramento area, COVID-19 activity is on the rise at this time. As it is the case with much of the West Coast, we do know that California has been getting hit pretty hard in Sacramento, in the Bay Area, also south of there, down in Los Angeles. Yes, things are going up there. We'll take a look at Los Angeles just a little bit later in this video, towards the second half of the video. All right, Dennis, the COVID info guy, he posted about the Canada COVID-19 forecast. I believe he's getting this from PMC dashboard. But here's the latest numbers as to what things look like in Canada. 1 in 65 people are infected at this time. 57,000 to 77,000 new daily infections in Canada. Yeah, that's a big number. And weekly infections in Canada, get this, 399,000 to anywhere between that and 536,000. Yeah, that's a pretty big number. 15,000 weekly long COVID cases, 4,100 hospitalizations, and 8,000 weekly deaths. Now, for those who do not know, well, how long do you have to be positive before it's considered long COVID? If you're still feeling sick, things are not getting better, or something new is popping up with your infection, maybe 3-4 weeks out, yeah, at that point, you got to start thinking, maybe long COVID. Now, some people, I will say this, some people with the initial infection, it does take a couple weeks to turn up negative. Or, as was the case with me, you will become negative for COVID, and you will start to feel better, and then a few days later, maybe something like a headache, coughing, or maybe something will reappear, and then you say, what the heck? Just for the heck of it, take another test. You may become positive once again. Yes, it does happen. It happened to me back during my winter case, and, well, I gotta be honest with you. When I turned positive again, I was positive more days that go around than I was a week before when I initially was positive. It can take a long time for you to feel better. It took me a month to start to feel any better. Some start saying, oh, you sound a bit better today. Yeah, well, I didn't feel any better. My head still hurt, and, well, as we all know, headaches are still a problem for me. Fatigue is still a problem, and on I could go. And that was just infection number 2. Yeah, I had a 2020 infection as well. But you get the idea here. That's long COVID. Deaths are still a problem. Yes, estimated weekly deaths, 800. That's higher than what we're reporting here a week in the United States. But I got to tell you something. We're significantly undercounting the deaths here in the United States at this time. Alrighty, moving on now to this. Western Australia weekly COVID update, week ending August 31st, 2025. And the good news is COVID there is starting to drop. COVID positivity rate is 2.8%. down by 0.9%. PCR cases, 209, down by 26.4%. Hospitalizations decreased to an average of 53 per day. ICU 7-day average decreased to 1. That's down by 66.6%. So that is some good news. Moving on now to this. COVID-19 outbreaks in Australian residential aged care facilities. As of September 4th, this is not good. Yeah, it's going upward again. Active cases, 654, were up by 14.3%. Active outbreaks, 99, up by 5.3%. Resident cases, 456, or up by 6.5%. Staff cases, 198, or, up by 37.5%. Reported deaths in 2025, 374. Again, that's up by 5 as well. So things are going up in Australia when it comes to long-term care facilities, nursing homes, or as they call it, residential aged care facilities. So, yeah, that's not good whatsoever. 7,578 aged care COVID deaths since the beginning of the pandemic. 686 in 2020, 226 in 2021, 3,855 in 2022, 1,359 in 2023, 1,078 in 2024, 374 reported in 2025. That number is significantly down from last year, but remember, it's going up right now. So, in the end result, though it'll probably be lower, it could get up there close to that number from last year. The hope is it stays below 1,000. Heck, I hope it stays below 500. Can that happen? I don't know. Again, like I said, things are starting to go up once again. So we'll have to keep our eyes on this. Alrighty, moving on now to the China update. And we do thank Will Newcomb, who posted over on my website this update from China. And generally some good news there. COVID has dropped at this time. Let's see, the positivity rate is 8.5%. That's good. That's down by 2.3%. RSV is 3.7%. That did go up slightly by 0.5%, as did influenza, which is at 2.4%. That went up by 0.6%. And some of the other viruses are bouncing around as well. So things are trending in the right direction for COVID in China at this time. Yes, that is very good. All right, in Wisconsin, here in the United States, Clark County reports first human case of West Nile virus in 2025. We've seen this in a lot of different places around the United States, and we will continue to see this as mosquitoes are still an issue. Alrighty, that does it for today's news portion. We're recording about 1:45 in the afternoon, so I suspect more things will pop up later in the day, and I suspect tomorrow is going to be a very busy virus update, and anything we don't get to tomorrow, we'll do a catch-up period on Sunday, because who knows what the news is going to be this weekend. Wait till you see the data from the CDC as to why I just said that. All right, I got to show you this in case you did not see it yesterday. The UK came in with lower cases, 1,346. That was down by 95, but deaths went up, 52. That was up by 26.8%, or 11. And hospitalizations, 819. All right, let's take a look now. I should have showed this to you earlier. Here's the wastewater level for Canada. COVID-19 is moderate. Flu A is low. Flu B is low. RSV is low at this time. I should have showed that to you the same time as we saw that Canadian COVID forecast. Taking a look now at what's going on with air qualities, and while we wait for that, let's pause and take a hydration break, shall we? Alrighty, doesn't that feel much better? In fact, actually, let's refresh this again. We want to see the national level because there's some interesting things going on. We do see the Pacific Northwest is really bad. There it goes. Yeah, take a look at that. Purples, reds. It's starting to spread into the Rocky Mountains. Some problems in the southeast. And some of that is now making its way up into portions of the Mid-Atlantic and at least parts of the Northeast. So anywhere on the West Coast, please use extreme caution if you got to go outside. Be careful if you have COPD, asthma, or some other sort of breathing problem. Be extremely careful outside. And, of course, if you're in the southeast and even portions of the Mid-Atlantic and Northeast, yes, some yellows and oranges have come back into the picture. All right, let's take a look at what's going on with bird migration. Not as many birds migrated last night. Just shy of, or just over 200 million which is less than the previous days. We have seen some warmer weather return, and maybe that's holding some birds from migrating to the south. All right, let's take a look at those EMS calls. I got some bad news with this today. First off, Pinellas County, Florida is seeing a few sick person calls and a few other things. Philadelphia yesterday, this is really bad. 902 EMS incidents. Now, someone may be thinking in their head, oh, well, it was the first Eagles game yesterday. Yes, here in Philadelphia, we had an Eagles game. Some people tailgated and whatnot. The game actually did not end until, I think, after midnight. I fell asleep. I didn't even watch the whole game. There was a rain delay. It ended really late. That could be part of the equation, but you have to understand something. We are now, Friday after the Labor Day weekend. We're now coming into the range where people with COVID would be testing positive, or any other virus. We're not just going to say COVID. We got to say all the other viruses. To be fair to those who will say, oh, not everything's COVID. Well, we do know COVID is up right now. Anywho, 902 EMS incidents. And hopefully we can see Montgomery County, Pennsylvania. No, I'm trying to refresh this. It's just not working. There's a problem with the Montgomery County. And I really wish we could see Montgomery County. Because take a look at this. Just a little bit earlier. About, maybe, what time did I put this tweet out? 11:35 a.m. Look what was going on in Chester County this morning, Pennsylvania. Sick person, falls, stroke, heart problems, falls, heart problems, respiratory difficulty, sick person, respiratory difficulty, heart problems, back pain, respiratory difficulty, falls, hemorrhaging, respiratory difficulty, emotional disorder, falls, respiratory difficulty, sick person. You're seeing a theme here? A lot of respiratory and sick person calls. And let's do a live look at, has it gotten any better? It was a little bit ago, but never mind. Look at all these calls once again. Sick person, respiratory difficulty, unresponsive person, respiratory difficulty, sick person, respiratory difficulty, sick person. You're seeing a theme here. Do you remember about a month ago? In fact, before then, because they went up again. Do you remember back in late June, July, and then again in August, when Pinellas County, Florida was doing this, when we saw confirmed wastewater going up for COVID? Yeah, now we're seeing EMS reports here in southeast Pennsylvania really start to go bonkers, and I'm going to be listening to some areas in Pennsylvania this weekend. I'm going to listen to central Pennsylvania, and more so Center County, Pennsylvania, because they're on a 4-week stretch right now of super spreading events. There are 4 home Penn State football games in a row. That is really concerning, and I think they have to be seeing at least something from that at this point. Here's what's going on in Bucks County, Pennsylvania. Just 8 EMS calls at this time. Taking a look at the hospital situation in Pennsylvania, I would suspect we start to see more hospitals deal with the oh my, wow. Take a look at how many, I just refreshed this. Take a look at how many yellow hospitals we have today. We have a few in southeast Pennsylvania. We have 2 on what I call the Route 309 corridor. You know, it's the corridor between Philadelphia and the Lehigh Valley. We have a number of hospitals dealing with problems. Lehigh Valley, 1 in the Poconos. Actually, no, make that 2 in the Poconos. 1 down here in south central Pennsylvania. Another a little bit further to the west. You get the idea. The hospitals are really busy here today. Taking a look at what is going on in New Jersey. Inspira Medical Center, Mullica Hill, full and total divert. Jefferson, Cherry Hill Hospital, full. University Hospital at Hamilton is dealing with a full total divert. Psychiatric issue also at the other university hospital. You get the idea here. Things are trending in the wrong direction. New Jersey does report that there is continuing to be increases in emergency department visits for COVID. Though low, there is also an increase in hospital admissions. The test positivity is elevated for COVID and a few other viruses. Levels of COVID-19 in wastewater are low, but have increased slightly in a few weeks. We'll take a look at COVID wastewater from Wastewater Scan over the weekend. Maybe we'll do one New Jersey wastewater site today. And the predominant strain is XFG, which is a subvariant of Omicron covered by the COVID-19 vaccines. What we are not seeing them say is COVID outbreaks in schools. We're seeing primarily due to long-term care facilities. We'll have to look and see if schools get mentioned in the next few weeks. All right, drum roll, please. Do we have anything from New York State yet? No, we don't. So that will be one of the things we catch up on over the weekend. Take a look at this. Let's go out to the West Coast now. Take a look at this. Wastewater in Los Angeles, California. Yeah, it's quickly going upward at this point. Yeah, that's not a good thing. Now, it is not as high as what we saw 2023 to 2024, but what we are seeing is, though it is lower, it's a delayed peaking this year. It continued to go up in this week's update, and that seems to be a theme. Though things are not higher, like we saw last year, pretty much a lot of places in the United States are seeing these delayed peakings. All right, I do need to show you this wastewater scan. We're still high in all regions of the United States, and I wanted to show you the regional trends. X out that one for the Northeast. Take a look at the Midwest. The Midwest is still going up. The West Coast is still going up. The South here has dropped a little bit, but I gotta be honest with you. When we come over to this, which is the CDC page, we see the CDC reports that the South for COVID wastewater had a big increase this week and is still high. The West Coast dropped a little bit, but is still high. The national level went upward. The Midwest, yeah, that went up once again. That matches what we're seeing with wastewater scan. And we also do see that the Northeast drops slightly. I don't know if that's actually going to hold. I think that could even get corrected. And, of course, nationally, we are still listed at the moderate level. I don't know if we will make it too high before this wave actually ends. Remember, I believe it was Mike Horger who reported with his PMC update. They did make a change to the CDC level. So what is moderate now may have one time before been listed as high. I don't know why they have to do that. Why minimize things? Things are bad. Why try and make everything look nice and rosy? Oh, it's not so bad. No, it's bad. Long COVID is still happening from these cases. Take a look at this. Growing status, the epidemic trends map has changed. Yeah, we're seeing it. You know, they're putting declining in the South. I don't understand that. Why is it declining in all these states, but yet they just showed on the wastewater map that, oh, there was a big increase in COVID wastewater in the South. Now, there are some places that are still growing, though, and I guess this would be considered the South. Growing would be North Carolina, Arkansas, Oklahoma. Yeah, you're still growing at this time, but south of there is declining, and we do suspect Florida is going to peak soon. I wish we could see the emergency department visits. Yeah, more on that in just a second. The Northeast and portions of the Northern Plains, yeah, still growing or likely growing. Still a lot of problems there. Pacific Northwest, Oregon still a problem. Alaska is still a problem. We are declining now in Hawaii. That is some fantastic news. California is good news as well, although I don't know if I really believe that. It could happen there. It could be happening there. Texas, I hope that is happening there, although CJS report showed Texas was pretty bad in the past week, so we'll have to see. But Ohio, it still says growing there, but again, if we go to that state page for Ohio, we do see hospitalizations. Let me refresh this. We do see that hospitalizations in Ohio have stabilized this week. Maybe it goes up one more time next week, then stabilizes, and I think Ohio should start dropping soon because historically this is where you normally start dropping. All right, take a look at this. This would be normally the emergency department's page, but when the emergency department visits for people diagnosed with COVID, this is how it's coming up right now. Let me refresh this. Yeah, it's okay. They're changing things around here. What's this? Yeah, remember we used to have that page with the red line, and now it is not showing up. Okay, so I guess this is going to be the new thing that they show, and you can see here if we take a look at this. All right, it did go up this week. I'm seeing this for the first time right now. I would like to see state by state, by ages. Don't tell me they're going to take that away from us. It is showing here that it did still go up this week. So for those who are saying, "Oh, it's going to peak this week," that's it. The waves usually peaks around the 6th. It does historically. I think again we may be delayed a week or two on that national peak because while the South may be dropping, I think some things in the Northeast. You see current ambulance calls here in Pennsylvania, they're not good. We'll take a look at this page again tomorrow. This just updated. I've never seen it before. It looks like they've made some changes, and it shows here pages 2 of 9. Yeah, give me time to get myself educated on this, and maybe I will figure out what this is all about tomorrow. If you enjoyed today's update, give it a thumbs up, subscribe down below, hit that notification bell, share this video with anyone you know, and leave those comments down below. I will see everyone again tomorrow. Hey, we're going to have updates throughout the weekend. Until I see you again tomorrow, stay safe, everyone, and have a fantastic Friday afternoon. Thanks for watching.